Welcome, and thank you for choosing Ascension St. Thomas for your joint replacement surgery. We're excited to be your nurse navigators to assist and support you through your surgical journey and to help walk you through this joint class video. The purpose of this class is to help you feel informed, organized, and well prepared before your upcoming surgery.
You'll learn how to get ready for your procedure, what to expect during your hospital stay, and important information for after your surgery. You will also get some important tips to make sure your transition from the hospital to recovering at home is as smooth as possible. So let's get started.
I'm sure you have learned a lot about your joint and why your doctor has recommended you have your joint replaced. Please take some time to look through the section, What is Wrong with Your Shoulder, in the Living with a Shoulder Replacement book provided to you at your preoperative appointment. In this section, you will read information about your joint and the parts that will be replaced. If you have specific questions about your implant, please reach out to your surgeon. Preparing for surgery. All joint replacement surgeries need some preparation in order to achieve the best possible outcome. Watching this video helps ensure you and anyone assisting with your care are prepared for your surgery and recovery. In your home, make sure there are clear, wide pathways. Be sure to remove any throw rugs, area rugs, or anything else that could potentially cause you to fall. Be aware of any uneven surface and use caution when crossing them to prevent falls. Put items that you use frequently at waist level. In your bathroom, place a non-slip mat in your shower or tub. The best type of chair to sit in after surgery is a chair that has armrests. This could be a wingback chair, a dining room chair, or an office chair. Just make sure it doesn't have wheels on the bottom. You can also sit on the couch. Just make sure to sit on a side that has an armrest on it so you have a place to help push yourself up. Most patients find it more comfortable to sleep in a recliner after surgery. Right before surgery, clean your home, wash your bed linens, clothing, and towels. It is also important to prepare meals, gather supplies, and groceries. To help you heal effectively, good nutrition is extremely important before and after surgery. Arrange for someone to help care for your pet if necessary. One of the most important things to do before surgery is to choose your coach. This can be a family member, friend, neighbor, or you can have multiple helpers. Your coach will need to drive you to and from the hospital and drive you to any appointments after surgery. Medical equipment to help with recovery. You may need some helpful items at your home to keep you safe and comfortable. Getting them in advance of your surgery will ensure you have time to practice using them. The commode riser, shower chair, bottom wiping aid, and grabber tool are helpful items for after surgery, but they are not required. If you have the standard low toilets, the commode riser can be placed over it to make it easier to get up and down. The shower chair can be placed in your shower if you feel like you may need to sit down at any point during your shower. The bottom wiping aid can help when going to the bathroom, especially if you're having surgery on your dominant hand. The grabber tool can help pick up any items you may have dropped. What to bring to the hospital. Your stay in the hospital is not long. Some patients go home the same day, while others may spend one night. Your surgeon should let you know the plan before surgery. Whether you plan to go home the same day or spend one night, still pack an overnight bag just in case. Pack things like your personal hygiene items, toothbrush, toothpaste, deodorant, a couple of outfits, loose-fitting clothes like a button-up shirt or oversized t-shirt, shorts, loose pants are easiest. With your shoes, you want them to have a good rubber sole with a back or strap. No flip-flops, please. Your sling, if provided to you by your surgeon. If they have not given you one, you will get one in the hospital. If you wear glasses, contacts, hearing aids, or dentures, make sure you bring your case for them with your name on it. If you have sleep apnea and use a CPAP machine, bring the machine, mask, and tubing. Bring a pack of sugar-free gum to chew after surgery. This is part of our ERAS program, which stands for Enhanced Recovery After Surgery. Please see the brochure that was provided to you at your preoperative clinic appointment. Bring your medication list. Avoid bringing your own medications to the hospital unless you were specifically told to do so. Your medications will be provided by the hospital. If you have a living will or a durable power of attorney that you forgot to bring to your preoperative appointment, you can bring that and we will scan it into our system. The hospital does have free Wi-Fi, therefore you can bring your phone, laptop, or tablet to use in your room. Before surgery. Before surgery, it is important to clean your skin with the surgical soap that was given to you in the preoperative clinic. This helps reduce your risk of infection. Instructions on how to use the soap were provided with the information at your preoperative appointment. You will begin using the surgical soap once a day, starting 4 days before surgery, and wash again on the morning of surgery for a total of 5 uses. Use this soap to wash your body from your neck to your toes. Be sure to get everywhere you can reach. Ask for help if needed. Do not use this soap on your face, hair, or genital area. You can use your regular soap and shampoo for those areas. Please do not use the surgical soap if you are allergic to it or have a history of any skin conditions such as eczema, psoriasis, or contact dermatitis. If you do, use an antibacterial soap such as Dial. Please use a mesh poof or clean washcloth and towel for each shower. And remember, on the day of surgery, after your last shower, do not put anything else on your skin or in your hair. This includes lotions, ointments, makeup, hairspray, nail polish, perfume, deodorant, or hairpins. Change your sheets and pillowcases on your first day of showering with the surgical soap so that you can sleep on clean bedding. Change your pillowcases and sheets again the night before surgery. Do not shave within 48 hours prior to your surgery. Do not eat or drink after 11 p.m. the night before surgery, except you can have clear liquids up until 2 hours prior to your arrival time. This includes the pre-surgery drink if you were given that in the pre-op clinic, clear liquids such as Gatorade, sugar-free if you're diabetic, black coffee or tea, apple juice, water, soft drinks, just no milk, no dairy, no orange juice. Eat a light supper the night before. Do not eat anything too heavy, greasy, or spicy. The day before surgery, you will get a call to confirm your arrival time. Day of surgery. When you came to your pre-op appointment, you should have received a parking pass with directions on where to park. Please place this parking pass on the dashboard of your vehicle. You will park on the 6th floor of the Mid-State Garage and take the elevator up to the 8th floor. This garage sits at the corner of Church Street and 20th Avenue North. The Mid-State Garage elevators run from 5 a.m. to 9 p.m. If you need wheelchair assistance, please call 615-284-8348 when you arrive. Once you arrive on the 8th floor, there is a check-in desk just a few feet to your right. Feel free to bring your belongings in with you at this point. If a room is available, they will take you straight to your private room. Your visitor will be able to wait in your room while you're in surgery. Approximate surgery times. The surgery times vary depending on each patient, what procedure you are having done, and your surgeon. The average time for a total shoulder replacement is 1 to 2 hours. Once your surgery is complete, you will go to the recovery room. In the recovery room, you will be closely monitored as you wake up from anesthesia. The nursing staff will help you stay comfortable, and family or friends will be notified of your progress. You may see some tubes and equipment such as oxygen, a vital sign machine, IV fluids, Foley catheter, or a surgical drain. You may also notice that your mouth is dry and your throat is sore. This is normal. The recovery time can differ depending on each patient, but is typically around 1 to 3 hours. If you and your surgeon discussed discharging home on the same day of surgery, the nurses and occupational therapist will assist you with getting dressed, working with your sling, and preparing for your discharge home. If your surgeon discussed staying overnight in the hospital, you will be transferred to your private room, and occupational therapy will work with you before you are discharged. Your surgeon and care team will help you determine when it will be safest and most appropriate to discharge you. It is important to start walking as soon as possible after surgery. Walking reduces your risk of blood clots and pneumonia, prevents stiffness and soreness, builds muscle, and improves overall health. Do ankle pumps and use the incentive spirometer every hour while you are awake after surgery. Doing ankle pumps helps with blood circulation to prevent blood clots. Using the incentive spirometer will help prevent pneumonia after surgery. The occupational therapist will work with you on how to safely shower, dress yourself, how to take the sling on and off, and how to get around safely. You will be able to move your elbow, wrist, and fingers. You do need to wear the sling at all times except when performing self-care and exercises. Please wear your sling until your surgeon tells you that you may remove it. Some patients may have a drain present after surgery. Your nurse will monitor this and remove it when it is necessary. Your care team will remove the surgical dressing and place a waterproof bandage over your incision. Instructions on how to care for your bandage will be discussed with you in your discharge instructions. Please read through these discharge instructions carefully when you are home. It does have very important information that you need to know about your recovery. You will be ready to go home once you have met your discharge goals. These goals are: your vital signs are normal, you are able to urinate, pain is controlled with oral pain medicine, and you have safely worked with occupational therapy. If you spend the night in the hospital, please have someone arrive by 8:30 the next morning. Most patients are ready to be discharged by 10 a.m. After surgery, you will not be pain-free. The goal after surgery is to have your pain at a tolerable level where you can still perform daily activities. The pain after surgery is different from the pain before surgery. The first 2 weeks after surgery are the roughest in regards to the pain. Take your pain medicine as prescribed. It is important to take your medication before you have severe pain so that it has time to start working. While in the hospital, you will need to ask your nurse for pain medicine since it is on an as-needed basis and not a scheduled medicine. Swelling will also cause pain. Use ice packs to help keep the swelling down. Constipation. Constipation is a common side effect when taking narcotic pain medication, and many experience constipation after joint replacement surgery. After surgery, you are not eating, moving, or drinking like you were beforehand. Therefore, your bowel movements may be different. Staying hydrated, getting up and walking, and eating well-balanced meals can help prevent constipation. Once you leave the hospital, you will need to use an over-the-counter stool softener or laxative to help prevent constipation. You will continue to use these medications as long as you are on pain medication or your bowels are regular again. After your joint replacement surgery, antibiotics may be required before any invasive procedures such as a dental cleaning, oral surgery, or other procedures. Please consult with your surgeon on their specific recommendations. After surgery, patients may be at an increased risk for developing a blood clot. Your surgeon may prescribe you a blood thinner to take for a short period of time after surgery to decrease this risk. Although developing a blood clot is rare, please be aware of symptoms and notify your surgeon immediately. Symptoms include increased swelling, warmth or tenderness of your limb, sharp calf pain, shortness of breath, increased heart rate, palpitations, or chest pain. Preventing infections. Infections after joint replacement surgeries are also rare. However, you should continue to take precautions to avoid infections after you are discharged. Keep pets, kids, and other hazards away from your incisional area. Wash your hands often to reduce germs and follow your discharge instructions from your surgeon.